Hey friends, my name is Mukesh Kumar. Once again, I welcome you all in my YouTube channel. Dear friends, today this video is going to discuss all about the epilepsy, mean to say the seizure. Friends, you wouldn't believe that in older dates, mean to say decades ago, the epilepsy disease was considered as a stigma in the society. Even some of the people had considered it like any ghost or evil soul has adopted all the controls in the patient. But what happened in the later? In later, science developed the medications for this particular disease, and all the people came to know that this disease can be treated by the doctors and medication. Mean to say, friends, this is not a kind of stigma. Actually, this is a kind of neurological disorder which happens in the brain called epilepsy. Just go to the neurologist and doctors, definitely you will be cured with the help of the medications and treatment whatever it will be provided by the neurologist. So friends, let's start the video and know all about the epilepsy. So friends, if I say that what is the seizure? Seizure is nothing, just it's a neurological disorder associated from the brain and which causes the seizure. Seizure means the loss of consciousness all of a sudden, and sometimes patient feels jerking movements in his body. Mean to say temporarily loss of the control over the brain functions. Abnormal activity or neuron firing leads to the seizure, but it depends on the area where the abnormal firing is happening in the brain. And friends, this can be diagnosed properly with the help of EEG, CT scans and brain MRI as well. Abnormal firing in the brain could be the acute and sometimes it remains chronic. So just seek the help of the doctor, neurologist and other doctors nearby you. Friends, let's talk about the epilepsy types, mean to the classification of the epilepsy. So that is focal seizure, generalized seizure and epileptic spasm. Friends, among these three types of the seizure, just you will have to remember only two seizures, that is focal and another one is the generalized seizure. So let us understand one by one. First one is the focal seizure. Focal seizure means the abnormal activity regarding the electrical discharges and abnormal neuron firing happens in a part of the brain, in the limited area of the brain. Suppose if the abnormal firing taking place here, this part of the brain, and this part of the brain is responsible for raising your hand, it means you will be feeling the jerking movements and seizure movements in this kind of part of the body, because this part of the body is being regulated by this part of the brain, and here there's a abnormal activity of the electrical discharge is happening. So that's why it is called the focal seizure. In focal seizure, patients feel the localized symptoms, mean to say twitching and numbness and some other symptoms also, but sometimes loss of consciousness is also there. By the way, stiffness in the limbs and twitching and jerking movements and numbness, these are the common symptoms of the focal seizure. If I will be explaining the more all about the focal seizure, definitely this video is going to be very large in the seconds as well as in the minutes also. So let's discuss about the another one, that is a kind of second type of the epilepsy, that is called generalized seizure. Friends, remember, generalized seizure are the seizures which involves in the both hemisphere of the brain, mean to say the electrical discharges and abnormal neuronal activity and neuron firing is taking place in the entire brain. So that's why it is called generalized seizure. Friends, in further, the generalized seizure has been categorized in the various categories. First one is tonic-clonic seizure. Tonic-clonic seizures refers the muscle stiffness all of a sudden, and sometimes loss of consciousness occurs in the patient. Next one is the tonic seizure, which refers the all of sudden muscle contracts and muscle stiffness is there, and patients feel discomfort and sometimes loss of consciousness. Muscle stiffness and rigidity in the muscle tones are the common symptoms of this tonic seizure. Another one is the atonic seizure. In this atonic seizure, patients may feel all of sudden loss of the consciousness. So patient may fall on the earth, and patient may feel dropped all of sudden with the no consciousness feeling may also be there in the patient. Another one is the clonic seizure. Clonic seizure has also derived from the generalized seizure, in which repetitive rhythmic muscle contractions happens, and patient feels very much in the problem, and most common is the unconsciousness will be there. Another one is myoclonic seizure. Myoclonic seizure also a classification of the generalized seizure, in which patient feels jerking movements for a very short time of period, but there is no loss of the consciousness. Friends, the another one which is derived from the generalized seizure, that is called absence seizure. Friends, this seizure is very dangerous for all of us. If any patient feels the absence seizure, means all of sudden all the consciousness will run away from your body, and patient may suffer to fall down or leads to death as well, and sometimes no consciousness. Even the absence seizure lasts up to the minutes, so that's why it's a kind of a dangerous seizure which is called the absence seizure. Friends, the third category of the epilepsy, that is known as epileptic spasm. This is also known as infantile spasm because it happens and it happens in 6 to 12 months baby only. So that's why it is also called the infantile spasm. In this, there is a sudden changes and sudden electrical imbalances in the brain of the baby occurs also. So that's why it is derived from the generalized seizure. So in this, actually what happens, patient, mean to say baby, feel the rhythmic movement, and a specific episode will appear in front of the patient, and patient will feel very well, and after the 2 or 3 minutes or 5 minutes after, patient may also feel that particular seizure again. So mean to say the repetitive rhythmic muscle tone happens in this kind of seizure, that is known as epileptic spasm. So friends, let's talk about the causes of the epilepsy. For to know all about the causes of the epilepsy, just remember one thing, that is a kind of hint I am giving to you, that is vitamin D-E. Means the causes of the epilepsy may also happen with the patient who are suffering with the vascular disease. V for vascular disease. I stands for the infections, mean to say if patient is having any kind of infections, so it can be led in and converted in the epilepsy as well also. So if I say the another cause, that is T, may trauma also causes the injury or trauma leads to the epilepsy and seizure. So if I say about the A stands for autoimmune disorder. Yes, autoimmune disorder also leads to the epilepsy, and if I say that is M, mean to say metabolic disorder. Yes, if you are having some metabolic disorders, mean to say some hyponatremia or etc. whatever, so it also leads to the epilepsy sometimes. And another I is there, and that is the idiopathic. Mean to say idiopathic seizures, idiopathic causes are also there. So sometimes a patient feels the seizure. Neoplasia, and D for the drug induced epilepsy, and E stands for the eclampsia. So friends, in this video overall, just we came to know all about the epilepsy, that is a kind of epilepsy and what is epilepsy. In further, definitely I'll be making a video for you all about the ADRs and medications used in the epilepsy, and what are the mechanism of the epilepsy, and what is the mechanism of anti-epileptic drugs. I will be telling you all the things in the next video, because this video is going I think very long, so that's why. Bye for now and stay connected, be subscribed. Thank you.